different layers here in our community as far as how it affected all of us. And I'm going to try to touch on some of those, but what I really wanted to highlight today is how our local public-private partnerships have really helped during COVID-19. So what I'm going to do is I'm going to touch a little bit about how COVID-19 kind of affected us. It's probably far more layers than what I would describe here. But the truth is, in many respects, COVID-19 really just affected in a big way our these four items that I'm going to touch on. So I'm going to try to describe how this affected us in healthcare, what our local first responders had to experience during this time because of the effects of COVID-19. Of course, many of you have different effects happening in your own local business. We're going to try to touch a little bit on that and also in our community. But again, for the most part, I'd like to highlight what our local business and what our local public-private partnerships have really done to help our local community. You know, one of the things that people will kind of come to mind now when they think about COVID is how it also affected us, even in our own attitude, the political air, and so on and so forth. Those are side effects that really happen no matter what kind of incident, that large incident happens within a community. And so for the most part, hopefully what I'm going to try to present to you will kind of restore some of your faith in the human in our own community. Okay, so first of all, I want to touch a little bit about how this affected our local first responders. I think some of you may have heard from us during, especially about this time last year, for the need for more PPE. So at that time, there was a big shortage of personal protective equipment in the form of masks and gloves. Those were items that we simply just couldn't procure. It is a global shortage. It's not just happening within our own community, but it's actually happening all across the world. Disinfectants were also another item that affected our local first responders, and for the most part, because even though COVID-19 was happening, they're still responding to many other incidents that happen around the county. Car accidents were still happening. People still have heart attacks or need transportation to the hospitals, and so on and so forth. But now there's an added layer to that, where they had to put extra personal protective equipment, be able to disinfect their own equipment as they transport people. The other thing too is within our dispatch centers or 911 centers, they had to come up with new policies on how they do business. For example, some of the items that they had to come up with is how can they let first responders know that the people that they're responding to might be affected by COVID, or maybe even COVID positive. First responders needed to know that, so that way they can prepare. One of the challenges that they had was that because of the short supply of PPE, that they don't always use PPE in every single response that they go to. They are conserving at that time the use of PPE, and so they would like to know if it's necessary for them to put on more PPE at that particular moment. So it was a challenge for them. So they had to come up with ways to share that over the radio without actually giving out people's names or addresses and so on and so forth. There were just some pieces of information that they can't really do that kind of go into HIPAA rules and so on. And then in some respects, they also had to create new equipment. The picture I'm showing you here is actually one of the ingenious things that our local fire departments had to come up with. What I mentioned earlier that one of the challenges they had was to constantly disinfect their equipment after a response, after they transport someone. And so it takes a lot of time for them to do that, and they can't just simply go and respond to another one, especially if that vehicle is being disinfected. So our local fire department came up with a way to do this. Again, and I'm going to highlight this a little bit later, in partnership with one of our local companies, to come up with a way to spray isopropyl alcohol in their vehicles so they can disinfect quickly. This picture that I have here basically shows one of their SCBA tanks connected to a sprayer. They have a regulator on that SCBA to lower the pressure, and then they use that to spray isopropyl alcohol, or IPA, all around the truck. There's a joke going on about us buying IPA around here, and it's isopropyl alcohol. Anyway, just moving right along, another one that was greatly affected was healthcare. For one thing, our local healthcare providers, I'm talking about hospitals, by the way, had to come up with a plan for surge capacity. So for the most part, our hospitals are pretty much occupied on regular days. This is pre-COVID days and all that. So what they had to come up with is space within their own facility in case they have to put more COVID patients, in case there's a surge in COVID patients. They were able to come up with some space. I remember during that time too, we were talking with other facilities such as the Wayne County, one of the Wayne County schools and the college to see if we can use their facility in case we needed more space for surge capacity. Those plans are actually coming to place, and thankfully we never had to use any of those available space for surge capacity. Our local hospitals were actually able to handle the amount of patients that came in. Another thing too that was a possibility was for mass fatality. One of the things that we actually sat down and planned is to see how, let's say, if there's a mass number of folks who pass away because of COVID, what would happen as far as the need for morgues, the need for, let's say, morgue trailers or anything like that. Those were actually planned during that time. And the possibility for that was definitely, forward for us. The other thing too is I mentioned earlier about the global shortage of PPE. It also definitely affected our healthcare system. As you know, on a regular scale, they use masks, gloves, face shields, all kinds of disinfectants in their own facility. Of course, now that there's a global shortage, they were also struggling at that time. So it's one of those things where conservation efforts had to be in place. So they were literally using masks at that time over a longer period of time, far longer than what their really recommended use is. So they really did their part in trying to keep things conserved at that time. In our local business, I think many of you are aware of this, businesses had to create new strategies or even cease operations during that time. A lot of businesses didn't know. I mean, I've had some local business owners contact me and ask, what would be the best way to take care of this? We didn't have any answers. A lot of the answers that we know about are at that time just based out of studies and based out of anything that they can actually get to supply our local business. It was a complete struggle. We were reaching out to all our chambers of commerce here in Wayne County to see how we can, what kind of messaging we need to share with our local business so there's a level of business confidence at that time. Some businesses had to change their operating procedures. Some of you may be working from home right now just to minimize contact within your offices. And I think for the most part, this kind of highlighted some items that businesses may be lacking as a way to continue business if they had to close their own facilities. One of the things that it actually affected during that time was there was an immediate shortage of electronic products. I don't know if you remember this, but about this time last year, it was getting tougher to buy things like webcams, or even laptops and printers. So it's one of those things. If anything, it also raised the price of some of these items because it became a very important commodity. Some supply chain items from China are short or became unavailable. I was talking to one of the local bicycle shops here in Worcester, and walked into a shop at that time, and he didn't have any inventory. A lot of the shipping priorities actually was shifted to distributing PPE at that time. So in turn, what happened was some of their supply, even their inventory items, just became unavailable. So that became a struggle for that, and I'm pretty sure some businesses probably had similar issues. You know, one of the other things too that we experienced here in Wayne County was meat processing became an issue. Some of the local meat processors around the state had to close because of the effects of COVID. So at that time, they had to send some employees home, kind of keep them all isolated. But at the same time, it also halted the processing of meat products. What that did, as far as locally, is that a lot of our pork producers weren't able to ship out their own product. I mean, for beef, it's probably a little bit different because they can hang on to them a little bit longer. But when it comes to pork and chicken, they grow so fast that they had to find ways to actually go and distribute that. Some of the planning items that actually occurred in the state that we were also involved in was the possibility of doing mass euthanasia of some of these animals. Thankfully we didn't have to go there. The good news is that a lot of our local farmers were very creative in being able to distribute some of their farm products and so on. During that time, we were actually talking with different leaders, different farm leaders, to see how we can come up with creative ways to further distribute some of their meat products. The good news is that later on, some of the meat processing plants opened and was able to process these products. But then there were other things that cascaded from that, things like some of the milk and egg products didn't have a place to go because other industries, or I'm sorry, other industries such as the restaurants or cruise ships were actually closed. They're not able to send some of those products out, and so we had a surplus of some of those. You probably heard in the news during that time that even in some states, I don't think it happened so much here in Ohio, but some states were even dumping milk because they just didn't have a place to go. In our community, things changed a lot. The ability to be able to visit each other really became very limited. Picture I'm showing there is someone visiting their relative in a nursing home. You know, one of the pictures that I distinctly remember, and this at one time I was taking a box of PPE over to one of our local health nursing homes, and someone visiting his mom. Literally, they were roughly about 20 feet apart, outdoors. They were seated in chairs, and you could just tell that they wanted to sit close or be able to hug, and they couldn't do it. So this really affected all of us. Really, it's not just some people, but really all of us in a big way. It has some financial impacts in many of our families. Some people could not work during that time, and so it also limited their ability to bring finances at home. You know, I mentioned something in here about air quality. It's in a way, it's kind of a positive thing because nobody's driving and everybody's staying home. The picture I'm showing there is actually from LA. I don't know if any of you have visited LA in the past few years. Anytime you go, it's always full of smog and you can never see the skyline out in LA. This is a very different picture because you can literally see the buildings because because everybody stayed at home or worked from home. The only other thing that did not really help a lot, though, is the political air. I think today the political air still remains polluted. Anyway, let's move on. So what I wanted to highlight for you is actually what public-private partnership is and how it helped us here in Wayne County. And one of the things that really was very remarkable is how our local, really everybody in our community stepped up to be able to help each other through this time. So what public-private partnership is, it involves government and business to work together to help the public. And what I mean by that is work together during serious incidents. Okay, so there might be times, you probably heard of times when a community is affected by tornadoes or hurricanes and so on, and how the private industry was able to step up and help the community be able to restore. So it provides the community for local government agencies, businesses, associations, colleges, and universities, other nonprofits to engage in crisis disaster protection. So it's not just limited to, being able to come in and provide goods or anything. It's actually a two-way street. So there are ways that local government can also be helpful to local businesses in being able to come up with planning or even ways to be able to do recovery efforts in the future. And I'm hoping that sometime down the road, as things clear up a little bit, that we can engage with you in how you can be a part of response and recovery efforts if something big happens in our community. It promotes business continuity. So, one of the things that it does, because if you just simply wait for government to put things in place to help the community, it takes a long time. There's a lot of moving parts when it comes to government doing it alone. But in partnership with the community, the local community businesses, it really speeds up recovery. It speeds up all the response efforts, recovery efforts. Among our local businesses, there are many subject matter experts. There's been times when we had a chemical release or spill here in Wayne County, and we called upon one of our public-private partners to see, how we can safely clean up some of these chemicals. And it's their expertise that actually helped the local fire department be able to fix that. So here in our county, for COVID, in regards to COVID, a lot of our local businesses really filled in the gaps. So during that time when there was a need for different items, and we put communication through social media and the local newspapers, even the radio. A lot of local businesses actually stepped up and was able to look through their own stock and warehouses to see what they actually have sitting there that, perhaps it's something that they never used in a while, but now it became an important item. We were getting phone calls from different businesses to come in and help. One of the things I wanted to highlight, and I didn't have a picture of this, is that we actually here in Wayne County have a local distribution center for items that are sold in discount. Okay, these are discounted items, but it just so happens that in their own warehouse they have pallets and pallets of gloves and disposable masks that they were able to set aside and quickly give to our local first responders. We took advantage of that. They stepped up and literally just gave us boxes and boxes of this when we couldn't get them. We were one of the few counties here in the state of Ohio that actually had some of that supply to give out to our local healthcare and first responders because of solely from that help coming from a local distribution company. So, just to kind of give you some highlights, I'm going to highlight some more, and I'm going to describe what you see in the pictures as well. And, hopefully at the end of this talk, you'll be giving yourselves a pat on the back and how each one of you really was a part of this in helping out. So one of the items, some of the items that local businesses and private industry was able to help us with is in the form of PPE. I mentioned about that that distribution center that was able to help out. Disinfectants was another one. A lot of companies that happen to have cleaning products. I mentioned earlier about this local company that used isopropyl alcohol. They were big in being able to help our local first responders and really government offices in providing IPA or isopropyl alcohol and this help. One of the items that I mentioned is morgue space. Here in Wayne County, we do have some morgue space, but it's very limited. And one of our local funeral homes literally just went ahead and constructed space so they can increase their capacity actually fivefold. They were able to quintuple, I don't know how to say that, but actually multiply a lot of their morgue space, and primarily because they needed to expand to start with. They were already talking about that even before COVID, but they actually decided to make it a lot bigger than what they normally would have needed, particularly to help with COVID. Transportation was another thing that, and planning was actually one of the highlights that came out of this. Local transportation providers here in Wayne County were able to get together and come up with strategies to be able to help people go from point A to point B. I'm talking about people who have limited access to transportation and be able to do that safely. But not only that, but even through the times when Wayne County is beginning to vaccinate folks, these people stepped up to be able to help people who didn't have transportation get to vaccination points. Food distribution is another thing that became important. As you know, a lot of the schools have closed during that time, and many kids didn't have access to food. And they pretty much rely on schools being open to eat. Some of our food distribution actually came up with creative ways to be able to help in that regard. They had some collaboration with transportation providers to be able to provide that. And again, this is all in the spirit of public-private partnerships. And then also in supply chain, when I mentioned supply chain, a lot of that information sharing was actually going on between the feds, the state, and us, and we're able to send that over to many of our partners here in Wayne County. It was a struggle later on that some doctors' offices wanted to open, and they couldn't because they couldn't get any PPE. Some of the information that we were able to provide for them are suppliers that are readily able to ship some of these much needed items like PPE and disinfectants so they can begin opening their doors. Local restaurant also had that issue. They couldn't get any PPE or disinfectants. And again, some of that information sharing really did help. So one of the local highlights I wanted to point out is that we have Mr. Vic Shantz here in the picture. He actually has a local group of students that are interested in creating 3D printed items. And one of the things that they did was they went ahead and created these face masks out of 3D printers. They produced quite a few of these, and we were able to distribute these items to a lot of our local healthcare and first responders. It's very well made, and they're very proud of that product. And again, it's not just really his group that produced all these components. That plastic shield that you see right in front of it is yet another form of partnership with another provider that went ahead and was able to cut those pieces of clear plastic to mount on the actual visor that goes on your head, so you can wear these face masks. Again, collaborative effort, public-private partnership, information sharing, all those things really come to play when it comes to being able to reach a success in this. Another item too that really came about are grassroots efforts to make homemade masks. You probably saw a lot of signs from people that they can provide these things. A lot of people came over and provided us with homemade masks to distribute. We were able to give out homemade masks. In the picture here, you see some of our local folks coming over here in our office to give us some of the few masks that they were able to make. Some people made maybe 5 or 10 of them. Some people, such as that one in the lower right-hand corner, was able to get a group of people within her church to mass produce these cloth masks. What she's holding there are actually child-size cloth masks that can be distributed for schools if they choose to open, or even for daycare. At that time, daycare was actually closed, but just in case it was needed for children, it is available. Here's another public-private partnership that I wanted to highlight for you. A local dry cleaning business was stepped up, and they agreed to go and disinfect these cloth masks before we distribute them. So people bring them over. They gladly took these masks and disinfected them, put them in packages, and then we were able to give them out. Again, another way of public-private partnership brought success to our efforts to curtail what's going on with COVID. It's not just in the form of that, but in some sense, we still have food distribution that needed to happen around Wayne County. But because of the shortage of volunteers at that time, and also the efforts that they needed to do to socially distance, we have Ohio National Guard come in and help in the local food distribution. So they went to the Worcester Hope Center, I think 3 times last year, to help just kind of stage some of these food items that needed to be distributed. And it was a great welcome thing, really, for the Worcester Hope Center to see our local Ohio National Guard coming in to help. Again, a result of public-private partnerships. So here's another highlight I wanted to share with you. During the time when mass vaccination was happening here in Wayne County, we started out sometime in February, actually late January. And here is an area in OARDC where we were able to line up cars so people can come in and get vaccinated. Now, the challenge in any of these drive-through type vaccination is the possibility of backing up traffic around the area where this is happening. So in other counties, when they do some kind of drive-through, almost every time the traffic around that area is just jammed up. They couldn't get traffic through. It's definitely a hazard, especially if you have emergency responders and need to go through. It's not going to happen. At OARDC, they have a section off the campus that they let us use. They open it up and just use solely for drive-through vaccination. And it was roughly about 1 mile to 1.5 miles worth of road that cars can literally just line up and get vaccinated. It was a very welcome thing. And I tell you, during that time, especially since the vaccines were being distributed, it was a very festive type air when this is happening. I mean, people were just so happy to receive the vaccine, and to the point where they were cheering. Some of them were even in tears that they were able to get it at that moment. Many of them at that time that were getting vaccinated were senior citizens. I think at that time the age range was anyone 70 and over. And I tell you, it was a great thing to see them go through. The other public-private partnership that occurred was being able to stand a vaccination clinic over at the Worcester Nazarene Church. The church was very gracious enough to open their own clinic, their own church, their own facility, so mass vaccination can occur. What you're seeing in the picture is on the left there. They were actually able to put up about 16 stations, so they can vaccinate 16 people at a time. So the throughput on this thing is actually very large. I think the largest, the most that they were able to do in one day is roughly about 1,500. What you're seeing on the right there are people, being just filling out some of their forms, but at the same time they're also hearing the some of the education items surrounding the vaccine itself. So they're getting more information about it before they get vaccinated. So, another thing that I wanted to show you is that this whole thing is a whole community effort. In that vaccination clinic that I showed you just a moment ago, it's actually, there was actually roughly about 6 different fire departments and agencies represented who came and volunteered to make that happen. So it's not just the city of Worcester Fire who was there, but you see people from Worcester Township, from Chippewa Township, from Apple Creek, from just a variety of different fire departments coming in and sending some of their staff to help out and facilitate this thing. So again, there was a public-private relationship that's happening there, not just with one sector of the public or one sector of the government, but this is actually a collaborative effort with many different agencies within the government enterprise. So another thing too that I wanted to highlight as far as public-private partnerships were some of the help actually came from outside companies at the same time. We reached out to some companies that we knew were sharing some resources, and I'm highlighting 3 of them here. One of them is Mercado Global. I don't know if you're familiar with that company, but they make handbags, and I think they also make some women's shoes. But they actually shifted some of their manufacturing to go into face masks. They're probably some of the most stylish face masks we ever received here in Wayne County. And they did give us boxes of these masks that we were able to give out to people. Very nice masks, very nice company. And another company there is, you see at the bottom, is Global Geeks. They distribute consumer electronics in the country. It just so happens that because they're shipping, some of their shipping resources they come from Asia, they were able to bring in some much needed masks, and they were able to supply us with some of these masks, especially during that time when we couldn't get them. Another highlight I wanted to show you is Ford company actually changed some of their manufacturing and produced some of these face masks. You see our lovely intern, Jordan Cheeg, who's from Oroville, by the way, just so you know. He's modeling the Ford face mask. And again, this is an item that we were able to distribute to our local first responders. So why are they willing to help in this way? Well, there's actually a mutual thing going on. Number one, there's social responsibility. They're able to help, and they felt that this is one of the socially responsible things that they can do. But at the same time, I'm pretty sure that there's a level of public relations and advertising that also goes back to them in the end. I'm very positive that Mercado Global, is able to get more exposure, as well as Global Geeks, more exposure about some of the things that they do, because they were able to help local communities with some of these items. Sure hope you guys are going out there buying Fords now because of the face masks. Okay, so with that, I wanted to just really reiterate and emphasize that public-private partnerships is really very pivotal in helping us be able to manage the effects of COVID-19 here in Wayne County. So I think without that relationship, it would be very difficult to really manage through that. We probably wouldn't be able to get some of the help that we were able to give our local first responders and hospitals and nursing homes during that time when they particularly needed. So I'm going to continue to talk about public-private partnerships because I really think that there are many opportunities for our local industry and businesses here in Wayne County to partner with us and really our first responders to see how we can help our local community recover from large scale incidents. So anyway, that's all I have to share with all of you. We are located here in the Justice Center in Worcester. There's our contact information. And I'm going to try to share that too in the chat. So that way, if in case you needed to call or maybe share some more information that I didn't share here, we'd like to be able to share them in our social media. So feel free to tell us if there's something that you wanted us to highlight, or even maybe we can do some co-planning together with your safety teams within your own business. So with that said, I'm available for questions if there are any.
Feel free to post something in the chat box or the Q&A. We can open up your mic and let you ask that, or if you have any comments. Sometimes this isn't a real talkative group, so I warned Joe about that in the beginning, so he won't take offense to that. But do take note of his email address. I'm sure that he would be happy to talk with you. So with that, we'll just go ahead and kind of wrap up things for today. Again, thank you so much for taking time to join us for the Oroville Area Safety Council. Oh, that's good. We have a note in the chat to say thank you, Joe, for your presentation. So you get a little bit of feedback from our group. That was a good overview. Truly, we have very generous businesses and community partners here throughout the county. We're very blessed with that, and certainly a year like 2020 showed us all that we needed to step up a little bit and contribute to our communities.
You're welcome.
All right, so we will see you all back in June, and the topic for June will be on weather safety. So we have someone from the National Weather Service that will be speaking with us about weather safety within your business and different protocols to pay attention to and put in place to help keep all of your workers safe as we go into the summer storm season. So have a great day, and feel free to drop me a note with any suggestions for program topics as we start planning fiscal year 22. So have a great day. Hey, thank you, Joe, so much. We appreciate it.